Question number 4, Barbara Stewart.
Thank you very much, Mr Speaker. My question is to the Minister of Health and asks, does he have confidence that the Ministry of Health is providing the best public health service for rural New Zealand communities?
Speaker.
Honourable Dr Jonathan Coleman.
Mr Speaker, yes. Last year the government provided record funding of $11.4 billion for district health boards, including specific funding to support the rural communities that they serve. Rural health service delivery has been particularly strong in Northland, where last week I met with hard-working Bay of Islands hospital staff and primary care providers. They were just part of the extra 74 doctors and 99 nurses employed by the Northland District Health Board under this government.
Supplementary.
Order. Supplementary
you,
question, Barbara Stewart.
Can the Minister confirm that the Waitemata District Health Board will not close down the Wellsford Community Health Office after the 6-month lease expires, meaning that Wellsford residents will have to travel 21 kilometres through to Warkworth in order to receive their necessary health care?
Honourable Dr Jonathan Coleman.
Mr Speaker, what I can say is the Waitemata District Health Board has had a huge increase in funding in the last year. It's very well chaired, and basically they're having to put their services where the public are best placed to access them, and it's all about delivering the best possible health care for New Zealanders.
Order.
Supplementary.
Supplementary question, Barbara Stewart.
Thank you, Mr Speaker. Why has the Ministry of Health allowed the Wellsford Community Health Office to be relocated to a public space where people now need to walk through the so-called office to use the bathroom facilities?
The Honourable Dr Jonathan Coleman.
Look, I'm not familiar with the bathroom arrangements in the Wellsford Health Office, but I'm sure the District Health Board is doing their very best to make sure that both health and bathroom facilities are made available for the people of Wellsford.
Is this something Winston?
Supplementary.
Supplementary question, Barbara Stewart.
Thank you, Mr Speaker. Is the Minister concerned that more rural health offices will be forced to close or be forced to move to unsuitable locations once the additional $200 million in spending cuts are made to DHB budgets later this year, and if not, why not?
Well,
Honourable Dr Jonathan Coleman.
What I can tell the member is that there's been an extra $95 million poured into the Northland DHB in the last year. More doctors, more nurses, much more elective surgery. We've had free under 13 doctor visits there. They're doing very well on immunisation. So basically, health provision in Northland is improving all the time.
Supplementary question, Joanne Hayes.
Thank you, Mr Speaker. What progress has been made in delivering better access to elective surgery for Northlanders?
Mr Speaker, a very good question.
Honourable Dr Jonathan Coleman.
Mr Speaker, over the past 6 years, a remarkable 9,367 extra Northlanders received elective operations over and above the level that Labor was delivering in 2008, and including an extra 2,616 Northlanders who received surgery last year. This government is delivering more and more surgery for Northlanders, and that's a direct result of our proactive approach to delivering healthcare services in Northland.
Supplementary. Supplementary.
Supplementary question, Tracey Martin.
Can the Minister confirm that he understands that Wellsford and Tahana are in the Northland electorate and in the Northland area, and can he explain why spending is being cut in Wellsford and Tahana if the rest of Northland is doing so well?
Honourable Dr Jonathan Coleman.
Mr Speaker, well, the member is right. The rest of Northland is doing very well, as is Wellsford, and the people in Wellsford have access to top-class healthcare services.
Yeah. Question number 5, the Honourable Judith Collins.
Thank you.